marks the recognition of National Health Center Week, and it is our privilege and honor to have legacy and future represented here for community health centers in many different facets, and not singularly, collectively. So we, as a foundation, support 42 community health centers in our region across the 5 counties of southeastern Pennsylvania. We're very proud supporters. We've been supporting these health centers financially and as partners since 2004. And this past year, we've really grown with our health centers, and with the ACA, we've initiated a new piece of our grant programming to allow for building capacity and sustainability of these health centers, because with the expansion of Medicaid and with the onset of new folks being insured and needing primary care access, we felt it was our responsibility to partner with our clinics again to be able to provide that for them. So that's the brief history of what we do, but community health centers have been in existence for 50 years, and this year marks both a celebration and recognition that we have a long way to go. So we thought that one of the ways that we were able to recognize the work of community health centers nationally, but also locally, was to invite our esteemed guest today, Dr. Nancy Milio, who is the pioneer of public health policy. She will give you more details about her background and her investment in this space, but one of the originators of a community health center in Kercheval, Detroit, and in the 1960s and 1963. Do I have my numbers correct?
We opened in 66.
66. So one of the very first community health centers in the nation. She's with us today, and we're very fortunate to have her here, as well as Dean Antonia Villarreal. I'm so bad at your last name.
Perfect.
I'm so sorry.
Perfect.
She is the Margaret Bond Simon Endowed Dean of Nursing at University of Pennsylvania School of Nursing. One of your students is here today. Two of your students are here today. I'm so sorry. Who are our nurse interns through the foundation, and Dean Tony, as I've been allowed to call her, has graciously agreed to moderate our conversation and participate. She is an internationally renowned nurse and leader in research and policy, so we're thrilled to have her here, as well as our very own Reverend Dr. Lorena Marshall-Blake, who, as you all know, is the president of our foundation and vice president of Community Affairs for Independence, tremendous community advocate, and our fearless leader in the space that we're in. So it's my honor.
You know what she is. I can always count on her.
It's my honor to have them.
Thank you.
And I would be remiss if I didn't thank our entire team for helping and put this together, because this was many parts, an incredible effort from our team, logistically, and everything else that's involved. So I thank you all very, very much. Thank you for being here. We will have a number of questions asked and answered by by Lorena and Dr. Milio, and then if you all have questions that come up or that you've thought of in advance, we can take those at the end. So without further ado,
Great.
thank you so much.
Great. Thank you, Heather. So welcome, everybody, and let me just say that it's my great privilege and really appreciate the invitation from Independence Blue Cross to moderate this important session and to be here with such a legend. Actually, two legends, as I'm coming to learn here about Lorena's work in the Philadelphia region. And as we were saying earlier, I certainly really admire and respect the work of Independence Blue Cross, because they bring together two loves of mine, that of community health centers and that of the role of nursing in advancing health in communities. Dr. Milio, I'm going to call you Nancy. I want to share with the group that Nancy and I have a lot of things in common. Kercheval is in Detroit, and that's where I came from. I was there in the 60s, but a little I'm going to say a little toddler, and you can believe that or not, but I'm saying I'm was a little toddler then during that time. We were also worked at the Visiting Nurses Association of Detroit at different points in our history. And I found out today that we also shared employment at Children's Hospital of Michigan, where she worked on setting up a home care program for children with cystic fibrosis. And we went back talking about how children with cystic fibrosis were cared for during that time, and just the labor that was involved in not only caring for the respiratory chest percussions, but I hear Nancy was also a little bit of a mechanical engineer trying to deal with some of the oxygen equipment in the home there as well, which is what all good home care nurses do. But Nancy, I'd like for you to start talking about your center at Kirchval, telling us the story about when it was established, how it was established, what were some of the challenges that were involved in its setting up, just to give us some context so that we can see either how far we've come or how far we need to go.
Well, I think we've come very far, and we have very far to go. As I feel like I'm answering the question twice because I was talking to the reporter about this very same thing, but I will repeat myself to myself and say that basically I became a visiting nurse because, and that's the only notion of nursing I ever had. I had no aspirations to be in a hospital or any kind of institution, even though I loved that kind of experience. I thought it was interesting and challenging, but I wanted to be in the community because that was the best way I could think of to, quote, help the poor. I didn't know what I meant when I was growing up, but I knew that's what I wanted. And it just seemed to me that I had three choices. I could be a secretary, a teacher, or a nurse. That's all you could be in the 50s. And, well, that's all I knew about anyway. And so I became a nurse and went to college, which I had to fight to do because we didn't have a lot of money. And it was supposed to, of course, go to my brother. But I went some scholarships, and I went. And I immediately, on graduation, went to the VNA. And I asked to go to the poorest neighborhoods, and it took me 3 years to get there because the nurse who happened to be working in a particular area didn't want to leave it. But I got there, and then I essentially did everything imaginable to help people solve the problems that they knew they had and I knew they had, whether it was with their housing and with their kids and with their health, with food and all of those things, but they never seemed to get solved, and I was very frustrated. I did not want to continue doing the same thing. I mean, I worked like 10 hours a day. I could work on the weekends. I just did everything I knew of and held case conferences and all those things, got all these agencies involved and all of that stuff. You know it well, and it just didn't work. So I thought there has to be a better way. And it's a very long story, and I wrote a book about it, so I won't go through the details. But basically, I went back, and instead of talking to women and saying you should get your kids vaccinated and, you know, family planning and so on, I started making a list of their names, and I said to them, what would help you do what I'm asking you to do and what you want to do to keep your kids healthy and your family healthy? And so it became very clear. What they needed was child care, transportation, food, job. They needed access to a clinic instead of going downtown to the public hospital and wasting half a day sitting there. So eventually put together the idea of having a place in the community. There was nothing there. I explored everything I could find, and there was nothing there. So I met with former patients of mine, and we met in their kitchens and in their houses, and I said, what do you think of this idea? Originally, I called it a clinic. I said we could have a maternity clinic in the neighborhood. And they wanted more than a clinic. Thank God for them. I mean, what they were really focused on was childcare. And then we could have the clinic, and we could have other things, and that's what we did. And instead of it becoming a maternity clinic, it became, by their name, the Mom and Tots Neighborhood Center. And it included not only maternal child health. We contracted with that demonic organization called Planned Parenthood, and I even had to persuade them. I mean, it was really interesting. At the time, they were kind of stuffy in Detroit anyway. And they came, though, and we had a van so we could provide transportation to take women where they needed to go, not only to any clinic that they had to go to out of the neighborhood, but if they had to go to apply for welfare, or if they apply for a job, or apply for school. We had a community advocate for them, and I had my staff that I trained for daycare, and we had a grand cook who really knew how to do things right, and she did it even in good nutrition, taught the kids, and I had to design the center. I mean, because there was nobody else to do it, so I did it, and made sure that they could see the kitchen. Couldn't go in it, but they could see it, and they could see her working, and there was ideas of everybody had access to everybody else, and everybody was trained to do all the jobs. And then, of course, came the little problem of money. And there was no money. Thanks to the foresightedness of the director of the VNA, who was in her second year, I think, at the VNA, and this was very risky for her, she and I looked for money. And we went to the state, we went to the federal government. She called every nurse she knew in the federal government, and they all said, yeah, that's a great idea, but we know that would work, so we don't need a demonstration. Well, I mean, who wanted to demonstrate? I wanted to do it. And there was no money to do anything. All you could do is demonstrate it, and somebody had demonstrated it somehow before, so we couldn't get any money. Then the poverty program came, and we went after that. And that's a long story, too, and I'm going to tell you a little bit of it. Just because it demonstrates how I felt at that time. Because the mayor wanted to control everything, we had to jump through hoops through the Detroit bureaucracy to get money from the poverty program funds. And that meant going through the docs, too. And they thought nurses had to keep in their place, just like they were almost all men, and that meant women had to keep in their place, too. And they were white, and that meant people who weren't had to keep their place. But anyway, we got the money, or that's what we were told, and we were ready to go. And then the call came, sorry, we don't have the money for you. They said you'd have to apply again for a separate grant. And that meant that I had to go back to my staff and tell them that. And that put me in the position of being a white person who comes in and tells black people, you can have this and this and this, and then it doesn't happen. And I'll tell you something I haven't told anybody. Might as well. You know. It hit me, I did that. You know, I told them. And I did it immediately because there was no reason for them, no reason to pretend anything. But I said to them, you know, I'll be back. And I said it to them so that I would do everything I could to come back and not give up. But what happened to me was I went into a clinical depression and I had to go to a shrink and for a few months. But in the meantime, I was working on all this and how to get the money and reapply and also get some fallback money from the community fund, many sources, put it together. We got it, we opened. And we opened with the disapproval of other nurses, because this isn't nursing, because they felt like, you know, I was going to be making them feel bad because, you know, what's the matter? Going house to house, we've been doing this for 75 years, and how are you come along and you think you could do it differently? And then there were some older black nurses who said, why are you doing this? I didn't answer that. And then there were social workers who were saying, you're not qualified to head a daycare. And then there were educators that said, you can't have these folks teaching kids. And then there were docs, of course, that said, you can't have people who functioned like nurse practitioners. There were no nurse practitioners. You can't have people that functioned like nurse midwives because there were no nurse midwives at that time. And I had even dared to suggest to pediatricians, you know, well, why can't you take, you know, one of my colleague visiting nurses and train her so that she could do the, you know, pediatric exam and all that well-child stuff. Couldn't do that. The same with, you know, the midwife. Wouldn't do that. But we went on, and then we were actually saved when the Detroit riots came in July of 1967. The flames started on the west side, and we were on the east side. The riot came to the east side. And it turns out that all of the buildings, we were in a storefront, a double storefront. All of the buildings around the center were burned or looted, and we were not. And I had been calling my staff to ask them, you know, is the center okay? I thought for sure it was going to burn. Not intentionally, but I thought how could you avoid it? Everything was in flames. It was going to burn. And I didn't know. I didn't know if I could start again. I didn't know. But I kept calling. And then finally by morning, they said the center's there and it's okay. And they said there was this bee on the window, painted, that I learned later stood for Soul Brother. And the Black Power guys said they took care of us and we took care of them. And then we went in and we went into crisis mode and we got food and clothes and everything that we could think of that people would need in the neighborhood, because all of the stores and everything else were blacked out for a while. And after that, of course, we got big press. And after that, everybody who called us names wanted to be a part of us. The mayor, the docs, the educators, the nurses, everybody. And that's when I knew that the center would be saved. And that's when I decided that in time I would leave. And I think the beyond the territoriality and beyond the financial problems was another problem that I didn't know explicitly in the beginning, but it was finding a sense of mutual trust. I mean, why should poor black people trust me? Because I represented people that were untrustworthy. And so it took a while. I knew I would be tested. I knew that I had to do everything that I promised. I don't care how small it was. I had to do it so that over time they could see that I was trustworthy. But I do remember when things sometimes wouldn't go so well. I remember one staff person, I don't think she meant it literally, but she raised a hammer to me. And I stared her down, and she was difficult to get along with for a lot of people. But actually, we became eventually quite good friends, and she became one of the most articulate and strongest stalwart members of the Mom and Tots family. But when those kinds of events happened, they piled up on me in a way that I didn't realize. And I remember one day where that was probably the pit of it as far as my own self was concerned. I was on the second floor of this storefront. And I sat at the desk and I just started crying. I cried and I couldn't stop. And it finally struck me, well, which is really weird. I mean, I had been going to night school to get graduate courses in sociology and anthropology to help me think through what I was doing. And I thought so weirdly at that moment of such emotion. I thought, oh, this this is what they must mean by culture shock, you know? And after that, I had some distance, and slowly we worked our way so that, you know, over time, it was really neat. I loved it. I mean, I never saw such open-hearted people and such fervor, such warmth, such relaxed, joyous group of people. And I even got invited to their homes, I remember, one Christmas. And it was so great. And they were so beautiful.
So Nancy, you know, I think in that time of your history, I think you really captured the importance of these types of health centers in communities and really illustrate what a vital part they play, not only in health care, but in health of communities. And so, Lorena, I'd like to ask you, and again, from the conversations that we were having, you have really focused on community health centers and nursing.
Yes.
So can you tell me about, I mean, I shouldn't have to ask why, because I think Nancy just answered the why, but I mean, what is it that inspired you as a foundation to invest in those? And I'm hearkening back to, you know, reflecting back on what Nancy's saying, are the challenges that she described in the 60s that much different? Or how are they different from what our community centers are being faced with now?
Well, you know, to enter the conversation, a lot has gone on. I think we have to mention the Affordable Care Act. That is a part, and I think has been the impetus for much that has occurred. And if we look at the progress, it's been slow but sure, and I think Dr. Milio said that there's still much work to be done. I think when you look at just Philadelphia County and look at our own, there's been growth. In the privately funded health centers we support are growing not only and again, it ties in with what Dr. Milio said with regard to patient size and services. It's expanding. Again, when we start to look at the neighborhoods that we're in, it's a neighborhood revival. Some are building or building out. And then again, looking at increased collaboration. But what's been important for us, when you look at nursing and you look at health center, the two tied together. I often say that we have the audacity when we look at our interns as they're out in the different centers, they are learning public health. So we're creating the public health nurses of the future, all right? And they're getting hands-on training. And again, if we go back to our own history, our former president, who is now deceased, Fred DeBona, he came back from a session and he said, we have to do something about this. There's going to be a shortage of nurses. We have to find a way to make sure there's faculty. We have to make sure that there are dollars so that the nurses can continue their education. And when you look at what the foundation has been able to do, I jokingly say to my staff, we go from cradle to grave, and that we start with the internships, okay? We move from the internships with the scholarships. Then we do the scholarships for faculty. Then we move into the Robert Wood Johnson PhD program. So how do we take them all the way through so there's this continuous flow so it doesn't stop, okay? And it continues. And again, to go to Dr. Milio, we've got to be in the community. And I think when I think of the foundation and what we do with the clinics, the 42 clinics, what we do with our nurses, we are in the community making a difference, and not just today, but every day. And it's been going on since 2004. So again, it's a commitment, a long-term commitment that has been made to the communities that we live, work, and play in. And we want to make sure that if you feel good, you look good, but you're healthy. Again, I was thinking this morning as I was reading something that when we talk about community, we have to be very deliberate about it. Okay, at Independence Blue Cross and at the foundation, we're very deliberate about it. It's not an afterthought. It is the first thought as we look at our program.
I heard you, both of you, talk about two different parallels. Yours, Nancy, in terms of talking with some of the clients that you served in the community to see really what it was that they needed, and they said, forget about immunizations, we
Yeah.
need childcare. And Lorena, at lunch, you all described a process where you brought community health centers together, and I think you had some ideas as to where that you as a foundation
Yeah.
thought would be helpful, but, tell us about that process.
I think, again, there was a needs assessment that was done. And when we looked at it, again, you don't know what you know till you don't know, if that makes any sense, okay? And we thought we knew that they needed electronic medical records. So we had our view of what we thought the needs were. And so when we went out and we did the needs assessment, we found out that's not what they needed. The centers really needed, and again, we asked them, okay, we went directly to the horse's mouth, as one would say. And they said that they needed dollars for, they would still have their general operating, so we didn't take away from general operating. But what we did do was have them, we looked at, they said they needed marketing. How do we market our clinic? And then more importantly, how do we write a grant? It's one thing to write a grant, but it's another thing to write a grant for funds. And so they wanted assistance in doing that. So we said, okay, we'll give you the tools to do that. And as a matter of fact, we've done workshops with them, hands-on. Okay, and I think what happens when they all come together, there's this collaboration among even the clinics that say, here's how we can work together. Because one person's funded doesn't mean it takes away from what they're doing. It's like, how do we work together to get what we need? Because at the beginning of the day, at the end of the day, how do we help the community to make it better? How do we make sure that they have what they need? So it was an eye-opening for us. And I think even when we look at our nursing program, when we started back in 2004, we pulled together the deans of the nursing school. We didn't know. So show us, help us, what we can do to be helpful. So over the next, from now until 2017, we have these capacity grants that we have put in place, the foundation. I think it's $9 million that will amount to, in an effort to, you'll keep your general funding, but what are some innovative ways that we can assist you to be better or to be sustainable? Granted, we would always want to be here, but there's no guarantee that we will. So what can we do to ensure that even beyond us, that you will always be there?
I think both of you describe a good process of both engagement and also developing trust with your stakeholders. Lorena, you mentioned the Affordable Care Act and how either that has helped or challenged some community health centers. And I'd like for us to shift a little bit to thinking about some policy areas and solutions. I think one of the things that I'm struck with the Affordable Care Act is certainly that it's provided us with opportunities for healthcare expansion, Medicaid expansion in particular, and we know Pennsylvania has just adopted that since January. And I'm also struck at the same time that we have this movement of the Affordable Care Act is the emphasis on the culture of health, on how is it that we take care of people not just in healthcare settings, but where people live, work, and play. And Nancy, I'm struck. I mean, you were talking about this in the 60s. You were talking about population health in the 60s. And you were talking about the role of nurses in building that culture of health. But from a policy perspective, I mean, what do you think is needed to be able to help us move that culture of health away from the healthcare settings, but with equal emphasis in communities? And I think we were having some of that conversation a little bit earlier, and I know you have some ideas about that, Nancy.
I think you can approach that on several levels. At the moment, the national level just does not seem to be the place to do it, even though one of the things I did after I left Detroit was take a year and travel around the world on $5 a day. But I made it my business, since I knew a few people, to take a look at community centers, child care centers, and national health programs in a variety of countries. And through the years, I've worked quite a lot with WHO, and conducted policy studies in several countries, where they have in place at the national level a mechanism, say boards, that can look at the health impacts of broad areas of policy. In one of my books, I even proposed this, and I got the most nasty review by somebody in the government, in the Reagan administration, who basically said, "Oh, this woman's talking socialism." And all I said was, to have a board that could do this, that could look at the health impacts of housing policy, jobs policy, food policy, environmental policy, any area of domestic policy that obviously impacts health. And so, but at the local level, I think you could find a different tenor, depending on where you are. And it would seem to me that you can't have, I should say that around 1980, WHO defined primary care to include environmental health, to include community involvement, to include, clean water, that sort of thing. And it would seem to me that either you would have a clinical center that had institutionalized links to these other environmental and community services that impact on people's lives in a broader sense, or you'd have people on staff that would actually be responsible for investigating these problems and then pulling in the resources that are available wherever they are. I don't think, there is this, at least for a long, long time, there's this thing in nursing education where somehow you're supposed to be a super nurse, that you do all these things to take care of people, and let's say we're talking about people, nurses in the community, you take care of their ills, and you do all these other things as well. Well, that's all very nice when you're in school, but it doesn't work that way in the real world. You're not going to get paid for that. And you cannot ask people who are paid for one thing to do a bunch of other things, as nice as that would be. So if you want to have this larger dimension of health supporting the people you're repairing in your clinic, you've got to have a financed way to do it. As I say, you either have a contractual arrangement with these other agencies or groups to do that kind of thing, or you pay somebody on your own staff to do it. You have other bodies to do it. You can't put it all in some idealized role that's never going to exist in the real world. How much of what I did at the Mom and Tots Center did I learn in school? And I got an A in public health nursing, right? Zero. So, that's another step in educating people into the real world, and in getting rid of this rigid definition of profession. I'm sorry, but I never liked it, and I wasn't going to be bound to it, and that's one reason I got criticized all the time. You know, nurses aren't supposed to do that. And the nurses wanted it that way because they said, this is ours, and you guys keep out of it. Well, that's no good. That can't work. And we just got to get rid of it. And if we're
We've made some great progress in terms of, trust me,
Okay.
and some of our
Okay.
students here in terms of
I see them smiling.
moving that
Yes.
forward.
Good.
So
We
maybe we
have.
still expect them to be superstars and super people, but you know, we are doing more community engagement. I think the internships like you have here, I think show you some blend the real world with what's practical. And I think even as a profession, we've grown to where we really see nursing as sort of the bridge between the culture of health and what happens in the healthcare setting.
And just to add to that, I view when we talk about this culture of health, we're talking about the community. And we talk about not one size fits all. And so you can't go with these preconceived notions of what that community is going to need or what indeed the needs are. I get excited when I think of specifically, there's one of our clinics, Puentes de Salud, when I look at what they do. I mean, they do English as a second language, they have domestic violence, they look at how do we do after-school mentoring. I mean, it goes back to what Dr. Milio said, it's one-stop shopping. You're not just not shopping or one-stop situation. You may come in for one thing, but we're able to do all things because they're the challenges of the transportation. They're the challenges of, you know, how do we assist the whole family, okay? I think it's very much, it's one-on-one. It's not, you're going to come in with this list of things. I was thinking about, again, I love quotes, and many people know I love quotes. And I came across one this morning that said, I had said, let's be intentional about community, but when we fall, let their hands be behind to catch us. And when others fall, let's help them soften the landing. So how do we soften the landing so you have what you need so that you can thrive, so you can go on and be productive in the community that you live in, that you work in. And I go back to the foundation again, and that's why I'm so excited to be a part of it, because we get a chance to do hands-on. We're boots on the ground, and we don't think we know everything, but we do as much as we can to assist and make it better.
That's great.